Hello, my name is Greta, and I'm here to talk about the SBIRT on substance abuse. SBIRT means screening, brief intervention, and referral to treatment. Studies have shown that substance abuse is more common among those of lower economic status. Though addiction can afflict people across socioeconomic lines, people with stable incomes are less likely to have fall victim to it than those under financial stress. Addiction rates are doubled for the unemployed. The stress of unemployment leads to substance abuse. Addiction can also lead to problems performing at work, leading to job loss and lower income. Performance-based termination from work can make it more difficult to find new employment, further adding to stress-induced substance abuse. Lower incomes create a high risk of a downward spiral for people already struggling with substance abuse. The family environment is also important. Violence, physical or emotional abuse, mental illness, or drug use in the household increases the likelihood that an adolescent will use drugs. Alcohol, marijuana, and tobacco are substances most commonly used by adolescents. By 12th grade, about two-thirds of students have tried alcohol. About half of 9th through 12th grade students reported ever having used marijuana. About 4 in 10 9th through 12th grade students reported having tried cigarettes. And among 12th graders, close to 2 in 10 reported using prescription medicine without a prescription. Drug use is highest among individuals in their late teens and 20s. Of all of the drugs used by adolescents, cigarettes have some of the highest daily levels of daily use. Poverty increases addiction risk factors, according to the St. Joseph Institute of Addiction. They cite that poverty increases stress, feelings of hopelessness, decreases self-esteem, decreased social support for individuals expending all their time in making ends meet, and less access to healthcare due to cost. The correlation could also be circular in that substance abuse could cause people to slip into poverty, leading to a vicious cycle of self-destruction. However, this correlation is not absolute. Youth are a particular susceptible aggregated for substance abuse. Poverty increases addiction. Poverty, also other contributing factors aside from poverty or peer pressure, low self-esteem, stress, failing grades or bullying, and unstable home. Poverty is a risk factor in adolescent substance abuse. This is a unique risk factor among the others in it that it is easy to identify high-risk communities in a region via readily available demographic data. SBIRT, screening, brief intervention, and referral to treatment. Screening means quickly assessment of the severity of substance abuse and identifies the appropriate level of treatment. Brief intervention focuses on increased insight and awareness regarding substance abuse and motivation towards behavioral change. Referral to treatment provides those identified as needing more extensive treatment with access to specialty care. SBRT is an approach used to deliver early intervention and treatment to people with substance abuse disorders and those at risk of developing these disorders. SBRT is used as an approach to identify high-risk and afflicted individuals for substance abuse disorders. The screening for example, take a survey of risk factors and history of use from the patient. During a patient's annual physical exam, a survey regarding their high-risk factors and use of substances could be taken to assess their overall risk for abuse or current affliction. Brief intervention is to educate the patient and to set strategies and goals to overcome the risk. Educate the adolescent on the risk and explore the source of their motivation for turning to substance abuse. This is the time to set strategies and goals for prevent further use. The brief intervention step is shown to significantly reduce substance abuse. Referral to treatment. The nurse can help evaluate community programs, treatment facilities, and get insurance authorization for the patient when treatment is needed. After the referral is made with the patient, follow ups with the patients and care facilities help ensure continued care and success in treatment. Substance use outcomes of patients served by large U.S. implementation of SBIRT. The result from pre to post SBIRT, we found large and statistically significant decreases for almost every measure of substance use. Model adjusted means indicate that the prevalence of alcohol use was lower 6 months later by 35.6%, heavy drinking by 43.4%, and illicit drug use by 75.8%. Greater intervention intensity was associated with larger decreases in substance abuse. SBIRT works. The numbers featuring positive outcomes from the process are significant, if not dramatic. It is truly inspiring. The Substance Abuse Prevention and Control SAPC program leads the facilities on prevention, treatment, and recovery support services to reduce impact of substance use, abuse, and addiction in Los Angeles County. Contracts with over 150 community-based organizations to county residents, particularly the and or underinsured. The Substance Abuse Prevention and Control program is to reduce underage and binge drinking, marijuana, methamphetamine, ecstasy, prescription medication, over-the-counter, and inhalant misuse among youth and young adults residing in cities and communities in Los Angeles County. This focus is on prevention, from one-to-one street level outreach to policy changes at the city level. Los Angeles County Department of Public Health use Substance Abuse Prevention and Control, which is located in Alhambra. And they also have a service helpline for screening and referral to treatment. Community resources. There's 4 items, which is acceptability, affordability, accessibility, and awareness. Affordability, the nurse can assist in gaining private insurance support as well as explore government-funded alternatives that could subsidize treatment partially or fully. Acceptability, they have assistance available to members who speak a different language, trouble reading, hearing, speaking impaired, and visually impaired. Accessibility has contracts over 150 community-based organizations to county residents. And availability, substance abuse service hotline 24 hours a day, 7 days a week. The integration of SBIRT into clinical settings attempts to raise awareness of substance use issues among patients and help them to find relevant treatment solutions where appropriate. The language, terms, concepts, and signs of need to be understood in order to be more effective at screening. SBIRT works. Alcohol use was lower 6 months later by 35.6%, heavy drinking by 43.4%, and illicit drug use by 75.8%. Greater intervention intensity was associated with larger decreases in substance abuse. The community nurse is integral throughout the entire SBIRT process, from the initial conversation to follow-up during treatment. Nurses must familiarize themselves with the culture surrounding substance abuse to maximize their effectiveness in screening for patients at high risk. Nurses should be encouraged and assured of the effectiveness of the SBIRT process and the real significant impact their work makes on the lives of their patients. In conclusion, Community demographics and epidemiological data. Median household income in LA County is 6,011. Person in poverty in LA County 12.8%. Children in poverty in LA County is 20%. Substance abuse disorder is 8.1%. The problem is the increased risk in substance abuse related to poverty and low household income. And program description is the SBRT, which is a screening, brief intervention, and referral to treatment. And the resources is Los Angeles County Department of Public Health, Substance Abuse Prevention and Control. The median household income in LA County is lower than that of state and national average. Poverty in LA County is higher than the state and national average. Substance abuse in California is higher than the national average. Correlation of poverty and low income with substance abuse is significant. Lower income individuals are at high risk for substance abuse. Focusing intervention efforts in communities that have the lower average incomes per household and higher poverty rates will benefit the most from substance abuse intervention. The high success rate of SBRT in substance abuse intervention will be a significant benefit to the community as it educates and empowers adolescents to overcome the pitfalls of drugs. SBRT calls for continued follow-up with the patients throughout the treatment process, better assuring positive care outcomes. Increased intervention in low-income communities breaks the cycle of substance abuse for more and more high-risk individuals, empowering them to focus on contributing to their communities by being more productive, responsible, and realizing better professional opportunities and incomes. Effective intervention reduces addiction rates and lowers community cost for treatment and policing substance abuse related crimes. Do you know of any substance abuse treatment center near your area? Do you agree that poverty and or low household income can contribute to substance abuse? Have you seen this correlation at work? Thank you for your time, and I hope you can fill out the post survey.